Hi, I'm Bisma, and you're listening to The Other C Word, a podcast about all things cancer from a stage 4 breast cancer warrior. We cover health and wellness, mind, body, and soul. Plan to leave each episode with hopefully some new insights and inspiration. Let's get into this week's episode. Hey everyone, welcome to The Other C Word podcast. I'm your host, Bisma, and I'm so excited you're joining me for this episode. I recently did a Ask Me Anything on socials and got a number of questions related to my diagnosis story, my current treatments, also around like what's my story in general. So I thought I'd spend this episode doing a full rundown of that and also give you some background into like who I am, who I was before getting diagnosed, what was my life like. And I think hopefully having that background will give you some insight into the person I am today. I've learned a lot about cancer in the year and a half I've been battling it, but also there's so much more that I want to learn. And I want to bring you guys along for that journey. So each week I'll do my research on particular topics and share with you what I'm learning. I'll also have guests on, doctors, nutritionists, people in the spirituality and the holistic space, along with other cancer warriors. And I want you to feel like you can communicate with me on socials and send me in your questions or things you're not sure about. And I can make sure to include those questions in when we have guests. Or if I'm doing a solo episode, I'll research those topics and talk about those. All right, so let's start with my diagnosis story. Okay, so this was February 2023. I was a little over 3 months pregnant and went to Austin, Texas to visit my family and tell them that we're expecting. We did this super cute thing where we got these scratch off lotto tickets off of Amazon. And in the prize box where you scratch it off, it says that we're having a baby. And so we did that. It was super cute. My whole family was so excited. And my husband flew back to California, and I plan to stay down there for a week and after that weekend and work from there remotely, and then head back to San Francisco, which is where I live. So it was a Wednesday. I was on a work Zoom and literally out of nowhere started having excruciating back pain. I'm on a work call, so I'm like holding in my panic and my pain. I tell my coworker, listen, I'm not feeling well. I need to hop off. And I start screaming for my mom, who's in the kitchen. She can't hear me because she's cooking. But my dog Bella hears me, starts barking, and that gets my mom's attention. My mom comes to the room that I was working in and helps me walk back to my bedroom. It's probably only like 20 feet away, but it takes me like 10, 15 minutes to walk over there because I can't move at all. And and then I lay down for a few hours, really bad back pain still. My mom's doing the typical like South Asian, Middle Eastern mom thing and like bringing me fruit and making me eat things. And it's just like none of that's helping at all. A few hours later, I'm still in awful pain. Every little move is making things hurt more. I'm just screaming. My dad gets home and he's like, listen, like, we should go to the ER. This doesn't look good. And so he asked if I can walk to the car. And I'm like, I literally can't move. And he's like, okay, we're going to have to call an ambulance. So we call an ambulance. There's like 5, 6 EMS guys that come, put me on a stretcher, go in the ambulance to the ER. And I think when I first got there is kind of when I was like, okay, like, is everything okay with the baby? Like, is that what's causing this pain? And so the first thing I let them know, like, I'm pregnant. Can I get an ultrasound and make sure the baby's okay? So they do that. Everything checks out. Baby's okay. And so it's like a big sigh of relief. And then I asked them, like, listen, like I need something for the pain. And the staff there, they're saying, like, we don't recommend anything strong or any narcotics because you're pregnant. And we also don't recommend an x-ray because the radiation isn't good for the baby. So they give me a really small amount of something. I want to say it was morphine probably. It does a little bit something for the pain, but not much. And I'm still like screaming, crying in pain. And it's like coming in waves, like kind of like spasms where it's like, or like a contraction where it's like coming, I'm like screaming, and then like it subsides for a little bit. That keeps happening. And then an ER doctor comes in and he says, hey, we can't give you any other medications because you're pregnant. And we're going to have to go ahead and discharge you. So he comes back in, puts the discharge papers on my bed, and walks out. I'm still in crazy pain at this point. So my husband was in LA for work and, he's been on the phone on and off throughout this whole thing. And one of his cousins is a high risk OBGYN. And so he calls her and he explains to her what's happening. And she says, go ahead and get an x ray. It's going to be minimal risk to the baby. And I'd rather we know what's causing the back pain. So we get the x ray and then they bring me back to the ER room. A doctor walks in. It's me, my mom, and my sister in the room with me. And she says, I've looked at your scans and you have metastatic cancer. No bedside manner whatsoever, just blurts out, you have metastatic cancer. And I remember I said, I don't know what metastatic means. My sister was holding my hand and she says it means stage 4. And so I think at that point, it just like things just went black. I don't think I felt anything. I think I was just confused and I was just in so much pain. Um, the next few days after that are like such a blur. Like they admitted me to the hospital, they did a bunch of scans. The scans showed that the cancer had spread to all of the bones in my upper body. So, like, my spine was one of that, my rib cage, my sternum, my pelvic bones, literally like all over the upper region. I did meet with a really great oncologist at that point, much better bedside manner, a lot more empathy. And he notified me that they figured out that there was a less than 1 centimeter lump, which is the size of like half of a peanut in my right breast. They biopsied that and they figured out that's where the cancer was coming from. So they determined it was breast cancer. They continued to scan my whole body to see like where else it had spread other than my bones. I would say in that, like awaiting for the brain scan results was probably like the most scary for me personally. But thank God, like that came back negative and that it hadn't spread to my brain, which is really good news. Also, other really good news was that it hadn't spread to any of my other organs. It was just in my bones. So in the biopsy that they did, they tested like the originating cancer cells and they figured out it's a hormone positive breast cancer. So when you're pregnant, your hormones are really high. So the doctors tell me this isn't easy to say, but for you to start your cancer treatments, you can't be pregnant, but we can't do the abortion here in Texas. So you need to fly to another state and get it done. And then you can come back here and we can start your cancer treatment. You don't have time to think about this. You need to move quickly. Every day you're pregnant, the cancer is spreading more and more. Okay, so on top of like a stage 4 cancer diagnosis, if I want to live, I have to terminate my pregnancy, but I have to fly to another state to do it. The fact that women can't get abortions in certain states, even if their life is threatened, is complete bullshit. So we find that out and then we're like, okay, let's get going. We get discharged from the hospital, go to my parents' house for a night, book a flight for the next morning. The game plan is to fly to San Francisco, go to an ER and say, I'm coming from Texas. I've got stage 4 cancer. I need an abortion to start treatment. We land in San Francisco. I'm heavily medicated. It's me, my husband, my sister, and my best friend, Sarah. My husband's business partner and close friend picks us up from the airport. We go straight to the ER from there. All of our papers are in this like big binder. We have the CDs with the scans on them. And we go to UCSF's main campus, which is like an inner city hospital in San Francisco. I'm sure you guys have heard about San Francisco and the homeless population, but this hospital and what I saw there was like really like a crazy scene. It's like something you would see in a movie. They later told us like the staff calls it meth Mondays because people from the streets are coming in as they're having withdrawals. It was just it was truly an awful experience. So we get admitted to the ER. My back pain starts getting worse and worse. And so we explained to them the situation. But during this night that we are in the ER, like getting admitted, my back pain is getting more and more pronounced. And I'm like back to like screaming, crying in awful pain. They put me on fentanyl that night and I start having hallucinations. I'm talking to other patients that are on stretchers in the hallway. I think they gave me like a mix of like morphine, Dilaudid, tramadol, fentanyl, like all of these crazy strong drugs. Some of it's like controlling my pain, but there's so many side effects from them. And because my pain is like still not being controlled, they're like, we want to scan your spine again. So they take me back, do a scan of my back. And when they come back to tell the results, now they tell me that I have not one, not two, but three compression fractures and three different vertebrae in my spine. So we end up having to do an emergency kyphoplasty surgery on my spine, which is where they put cement into the fractures to stabilize them. Then we do the abortion of the baby, which was highly emotional, but very difficult to mentally process while in so much physical pain. And then I finally start the cancer treatment. They put my body into menopause to stop my ovaries from producing more hormones, which is driving the cancer. And then I start a targeted treatment used for stage 4 breast cancer patients with hormone positive receptors, which is what I had. I then have to start PT, physical therapy, because it's been like 3 weeks in the hospital at this point in which I haven't walked or moved from my bed. I do about a week of PT in the hospital, and then it ended up being about a month total before I got discharged. Left the hospital on a wheelchair with a walker, did more physical therapy for the next couple of months to be able to gain strength in my muscles, to be able to independently move and walk without assistance, be able to use the restroom and shower without special equipment. So, really, a traumatizing experience to say the least. I think every time I've told this story or told my experience, it really does feel like a bad dream, but I also feel like it's so important to tell this story and to I also feel like it's important to tell this story because cancer diagnosis aside, the abortion aspect of this is just no one should be having to deal with this. So that was the onset of all of this. I'm a year and a half into my stage 4 diagnosis now. My first line of treatment was a CDK4/6 inhibitor called ribociclib or Kisqali. I was on it for 7 months before the breast cancer progressed and spread to my liver. I then was on a clinical trial, which is a medication called inavolisib. And we saw stability with the cancer spread in my liver for a little bit, but it was about 4 months that I was on that to where we saw new spread in my liver. And so we again switched treatments. And now I'm on my third line of treatment for people who have a BRCA2 mutation, which we tested for and I came back positive for. My most current scans show that the latest treatment is working really well. We're seeing a decrease in the number and the size of the lesions in my liver. The metastases on my bones are stable. So, overall, it's amazing news. And I'm super hopeful that we're going to keep trending in this direction. Um, I think overall, this diagnosis has been so impactful to my life. A lot of positive things have come out of it. Seeing the outpouring of love and support from my family, friends, my community. I've gotten really into nutrition, mindfulness, meditation over the last year. And I think most days I'm in a really good headspace. I'm happy with where I'm at. And of course, this is a really serious diagnosis, but I also want to keep, light and positivity top of mind and try to just live a really fulfilling life. So, yeah, that's where my health is at right now. And I also wanted to give you guys a little bit of background about me and kind of like my background story. So I'm from Pakistan. I was born there and immigrated to the U.S. with my family when I was in elementary school. From a super close, loving family. I'm the youngest of three kids. I have an older sister and an older brother. When we moved to America, we hopped around briefly, but pretty quickly settled in Austin, which is where I grew up. I played tennis competitively growing up and always did really well in school. Overall, a good kid, I would say. I graduated high school when I was 16, attended college at the University of Texas at Austin. And I started off as a sociology major and wanted to go to law school. Well, actually, before that, I wanted to go to culinary school, but my parents were a hard no on that one. So I went to UT Austin after a couple years studying sociology. I was like, yeah, no, I don't want to do this or go to law school. Literally remember I went and grabbed a bunch of brochures from like different schools and programs and then went to lunch with my best friend Sarah and we flipped through them and I saw the starting salary for petroleum engineering and I was like, "Okay, cool. Yeah, I'll do that one." And the rest is history with that. I graduated in petroleum engineering. My first job was working offshore on an oil rig. I lasted less than a year there and quit. This will be a common theme with me, like getting a job and then being like, yeah, no, thank you. This isn't for me. So I worked in the oil and gas industry for 7 years, 5 of which I worked at Shell in Houston. I was married to my first husband at the time. We were together for 7 years, so majority of my 20s. I then went to business school in Chicago, got my MBA, and then I worked in investment banking because felt like I hadn't tortured myself enough. And eventually, with investment banking, ended up moving out to the Bay Area. I think I was always just like, okay, whatever job pays me the most money, I will go for that one. It's not the best strategy for me personally because I always feel like I'm missing the passion piece of it. But yeah, so I did invest in banking for 3 years and then I ended up rage quitting during COVID because I was so burnt out. And then I took a year off and got a job at GoFundMe working in finance and strategy, which I'm currently still at. And I think it's an amazing platform. I think it's the closest I have felt in my career of actually having a meaningful impact on people's lives. So I will say the last couple of years at GoFundMe and now this year of creating content in the cancer community and now with this podcast, connecting with people, that's the most passionate I have felt about anything. So that's hopefully a good sign as to where I want to continue being. I want to make an impact and help people and connect with people on a personal level. So, yeah, that's me, guys. I hope this episode was helpful in getting to know me a bit, know where I'm coming from when I have guests on. I've also unfortunately seen firsthand like the inequities that people of color or people from different socioeconomic backgrounds face when it comes to healthcare and healthcare access in the US. So I think those are topics that I'll definitely touch on in this podcast as well. I also don't see a ton of Pakistani or Indian people on this side, like the patient advocacy side or patient education side of the healthcare system. We're great on being on the provider side and being doctors, which is awesome. But hopefully, this is a gap that I can help cover. And yeah, thank you guys for tuning in. Thanks for listening to The Other C Word, hosted by Bisma. New episodes drop Mondays. Connect with me on socials at Bisma, and let's all learn, grow, and inspire each other.